could buy coffee like that from Starbucks.
Yeah.
Yeah, any of them, they give you to-go boxes.
In any farm, do they have all kinds of farms?
So usually about that size.
I don't think the guy at the Starbucks was real happy with me though. I think I inconvenienced him. Oh jeez.
Wow, burgers, Krispy Kreme, all of them have.
He wasn't too happy that we ordered the big coffee this morning for some reason. Y'all don't have to sit all the way in the back.
Well, she wanted it.
Oh, she wants a comfy chair. Let's see how it is.
I'm good.
I'm on vacation.
Everybody in my place of work, they have these all hands meetings, and there's like 500 people
Because we
there.
go
Everybody
to
sits in
Emily
the
and I
back.
going to
Yeah.
Texas tomorrow. you know.
Front rows are empty.
Oh yeah, just like in college, just like in high school, everybody sits in the
Yeah.
back row. So we're gonna be streaming this Facebook Live as we do it. So
Great.
It's on.
we'll see how well it picks up my voice from all the way over here. But
Cool.
and
Bad
we
that
get
I
to sit in
couldn't
the front
get
row.
you. Oh, it's in the front row. All right.
Yeah.
So everybody here except for these two has not had much experience with chiropractic care. Am I right?
Zero.
Zero. A little bit for you, right?
Yeah, I had like a couple months where I was going when my back was real bad.
Okay.
Yeah, I'll say 0.
Okay. So hopefully this will be good. This is just a little quote that I like. That's Thomas Edison. You can read that. I think he was on the right track 100 years ago, basically. Lauren, are we rolling yet?
Mm-hmm.
Oh, well, hey, Facebook. Lauren didn't tell me that we were live, so we're live. Action
It's just my
now.
mom right now.
Huh?
It's just my mom right now.
Oh, that's okay. Hey, Dawn. So welcome to Coffee Talks. This is obviously the first one. I'm a new doctor. I just graduated in September from chiropractic school, and I'm in this practice because my mentor, Dr. Alex, we met when I was probably 12 years old, and he this office has been here for 15 years, and he took me under his wing, and now I'm back practicing here. So this is my first coffee talk, and hopefully it'll become kind of a monthly thing rolling forward as interest starts to grow. So we're going to kind of go ahead and get into it. Today's goal is really to talk about what chiropractic is, what a chiropractor is, and then what do we do and why is it important and that kind of thing. So what's a chiropractor? North Carolina defines us under lots of different names. You can call us a chiropractor, you can call us a doctor of chiropractic or a chiropractic physician. We're trained according to the law in physical examination, diagnosis, treatment, management, assessment, referral. All those things mean that we're considered a primary care portal in North Carolina and in a lot of other states as well. So what that means is that somebody can come in our door right off the street and we can make an assessment and make a diagnosis and treat them as we see fit without having to get any kind of clearance from any other provider. We can make referrals, we can send out for imaging, we can bill to insurance, all of those different things that any other type of healthcare provider or medical doctor would be able to do. Something that we've fought very hard for in our history as a profession. So in terms of our education, we're required over 4,000 hours of graduate level education. In our state, and probably 99% of all the other states, you're required to have a 4-year bachelor's degree. So I studied human biology at NC State, and then I completed my chiropractic school at Life University in Atlanta, Georgia, which is actually the largest school in the country at this point, in the world really, for chiropractic. Unlike medical students where their residency is tagged on to the end of school, they complete their classwork and then move into a hospital, our residency is built into the curriculum. So the last 2 years of chiropractic school, we see our own patients, we manage our cases, we work our way through seeing students and then seeing staff, and then we end up in a local office in Atlanta or somewhere else in the country practicing under a doctor and seeing patients and that kind of thing. So our residency is built in, and we've had 2 years of clinical experience by the time that we graduate. We have national boards very similar to what a medical student or like a bar exam or anything like that. It's a standardized test. There's 4 parts that cover everything from your standard sciences up to diagnosis and treatment and hands-on procedures and all of those things. In North Carolina, we're also required to take the National Board Physical Therapy exam. And then each individual state has its own licensure exam as well. So a lot of people ask, kind of how our education compares to that of a medical doctor. Well, it's actually very similar. In terms of course load and hours and subject matter, it's very similar. The total hours are very similar if you look from school to school to school, and the subject areas are very similar too. So the biggest difference you'll see if you actually look at the numbers is that certain areas of study, they may take more hours and we may take less, or vice versa. So you'll see a chiropractor is going to study a lot more anatomy and physiology and X-ray and diagnosis and that kind of thing, and a medical doctor is going to be more on the specialty side of, you know, your OBGYN and psychology, or the chemistry and microbiology, things that have to do with drugs and that kind of thing. So as a whole, it's very similar, but we just tend to focus on different areas. And that begs the question, well, why are we not an MD? The easy answer is that we are covered by different groups. So medical doctors are under the American Medical Association, and that's who gives the MD certification. And chiropractors, going back to the beginning of our profession, have always been separate and distinct from the American Medical Association. And so we're licensed by individual state boards. So here, the North Carolina Board of Chiropractic Examiners, and that's why we're a DC, Doctor of Chiropractic, and not an MD medical doctor. So easy answer to that question. Our primary tool for treatment is the adjustment, and you've heard of the adjustment. You've heard people talk about the popping and the cracking and all of that kind of thing. Some chiropractors will do adjustments that are not hands-on. In our office, we do hands-on adjusting. You can see the tables in the back there that we use. But some of the primary goals for an adjustment are listed here. We want to release a joint fixation, so make sure that the joints are moving the right way, that are stuck. We want to break up scar tissue, and we want to promote healing. We want to restore normal joint motion and normal curves, which we're going to get into in a few minutes. And then we want to ultimately increase nervous system function, because that's the master control system for the body, and that's ultimately what our goal is to make sure that your system is functioning well. There we go. So outside of the adjustment, we're also trained and certified to do a lot of different things. And if you go to a lot of different chiropractors, you will see a lot of different things. In our office, outside of chiropractic care, we do weight loss, we do nutrition, we do shockwave therapy, which is used for treating soft tissue problems like plantar fasciitis or tennis elbow, things like that. We do some physical rehab, and then there's some other things that we've done as well with different patients as necessary. And so it just shows, you know, we're not just a one-trick pony, I guess. Things that we don't do. We don't prescribe or manage any kinds of medication, pharmaceuticals, over-the-counter. It's not in our scope. We've never wanted it to be. It's always been that way, so we don't do anything on that end. We're happy to facilitate conversations with medical doctors, helping our patients to ask the right questions and those kinds of things, but we don't handle it ourselves. So we also don't give any kind of shots or immunizations, and we obviously don't perform surgery. Not interested in that at all. So we've established what a chiropractor is, we've established our education, and so now the question is, what actually is chiropractic? What are our goals? Why do we do what we do? So this is a definition that I really liked, found it online. It defines chiropractic as a system of optimizing human performance and potential by restoring or enhancing the body's function. So you'll see there's nothing in there about fixing pain or covering up a symptom or anything like that. We're concerned with the whole body and how you're functioning. Ultimately, that takes care of symptoms for most patients, but our goal is beyond that. The nervous system, like I said before, is our primary concern. You can see it on the left. The nervous system is the brain and the spinal cord and all of the nerves that go to all the organs and tissues and cells in your body. It's the master control system, meaning that without your nervous system and your brain and those nerves, you're not alive and you don't function. It makes sure that your heart beats, makes sure that your lungs breathe, that you digest your food, that you heal the cut on your finger, all of those things. Connects your brain to every single tissue, like I said, and it's controlling function and healing in the body. Something very interesting about this system, though, is that 93% of it, at least, is focused on function and healing, making sure that everything works well, like we've said. And less than 7% of it is focused on feeling pain. So what that means is that for a lot of people, just because they feel good and they don't have any symptoms, that's no guarantee that you're really healthy and you're functioning well. A great example is you've heard the statistic that more than half of heart attacks, the first sign of any problem is sudden death. That's why. because 93% of that system is not focused on feeling pain at all. And so that's why we always tell people, you know, just because there's no symptom, just because you feel good, we want to make sure that the whole system is working well. And then we get to the spine. The spine is what our focus is because that's what protects the nervous system. You can see on our little fancy model here, when you look at the spine, it's all of these bones. It protects the spinal cord. It protects all the nerves. When you look at it front to back, it should have a nice straight line like this. And then when you look at it on the side, it should have 3 pretty curves. We've been talking about this before. The curve in your neck is very important. So are the other two. It acts as a protective system. It acts as a shock absorber. And then each one of these little yellow things is the nerve that goes to your heart or your lungs or something like that. And so we'll say, for our example here, that this is the nerve that goes to your heart. It's right around there anyways in the spine. So the spine protects the nervous system, but it can also interfere with the nervous system if we're not careful. So one of the primary things is called a subluxation, basically just a bone that's not in the place that it should be. So when we do that, say if I twisted that, Andrew, can you see that? See how that nerve there is now has pressure on it? If that nerve was the nerve going to your heart, what do you think would happen to your heart?
Probably would start having problems.
Probably would start having problems, right? And then if I left the pressure on that nerve for 20, 30 years, how long do you think your heart's going to last?
No idea.
Not long, right? And eventually, if your heart stops working, you stop working. So that's just one example. We have that subluxation, that individual bone that's out of place. And then we also have problems with the whole system where you'll see somebody that has a scoliosis. You've heard of that, where you start adding curves to the spine. Or worse than that is where we have somebody and we start taking away the curve. When you start to straighten out curves or add curves in where they're not supposed to be, instead of just putting pressure on an individual nerve, you're actually putting pressure on the entire system. They've done studies on cadavers that show when you take the curves out of the spine, it stretches the spinal cord like a bungee cord. And so that's not good for any of the nerves going to any of the organs. Now, here's a good example of what that looks like. Again, Hippocrates was kind of on track there, talking about looking at the spine as the cause of disease. But this is a good picture here of just what it looks like on that individual level of having pressure on a nerve. You can see here that the bones above and below all have a nice healthy disc, and the bones are all healthy. And that means that these big holes where the nerves come out are open and wide. And then we have an area here where this disc is starting to degenerate. And that means that this hole is getting smaller and smaller, and now we have pressure on that nerve. And then here, the second two that we talked about on the model, the green lines are good. So when we look at somebody's posture, that front to back is straight up and down. On the sides, we have the nice curves, and that works well. It protects the nervous system. It acts as a shock absorber. And then we have the guys in red. That's like the car that the tires are out of alignment. The tires are going to wear down a lot faster than a car that the tires are aligned, because they're not going to wear evenly, and they're not designed to do that. And so that's what we talked about. This guy here, he doesn't have a curve in his neck anymore. That guy over there has scoliosis, and so their spinal cord is under tension. A good example here, in an area of the spine that doesn't move well, this is our tires wearing out faster. We know that if you have the curves and the bones do move well, then the disc can stay healthy and the bone can stay healthy. And in areas of the spine where it doesn't move well and we don't have the proper curves, it starts to degenerate. They call it arthritis, they call it degenerative disc disease, they call it degenerative joint disease. Different professionals call it different things. To a medical doctor or other specialist, this is normal aging. But what's very interesting is when you look at people's X-rays, especially people that have had trauma, it may look like this on one level and then look like that on another level of the same person. And so that begs the question, if that can't be normal aging, or the entire spine would look that way, right? So if that's normal and this is not normal, we want to prevent this. And we do that by using the adjustment to make sure that we can restore those curves and we can get the bones moving again the right way. And then again, just one more picture of what that looks like. So we're going to look at a couple case studies, a couple patients that I've had experience with. I'll tell you, this is from the office that I did my residency at, all patients that came through that office. The first one here is a person, a female. You can see the guard there, but she came into the office with scoliosis, very classic scoliosis on the left, big curves, her spinal cord is under tension, a lot of back pain, a lot of neck pain. And then after we took care of her for 3 or 4 months, this is what her X-ray looked like. And so you can see that there's a massive change. It's already starting to straighten up. And what's very, very interesting about this is we really didn't address this part of her spine that much at all. What you're not seeing on the X-rays is that when she walked into the office, this pretty curve in her neck was as straight as an arrow. And on this one here, she had a nice curve in her neck again. So once we restored that curve in the neck, everything down started to go back to normal again. This next gentleman is an interesting one. This is an older guy. He came into the office and he had just been at his medical doctor, and you can see there's something unusual. Is this piece going up? That's a catheter. And the reason that is there is because his kidneys were failing, 20% function. They had no explanation for what was going on. He was on the emergency kidney replacement list. He was almost in the point of having to be in ICU because he couldn't function. And you can see what's interesting is that you look at the spine, how it's leaning off to the side that way. Not normal at all. Putting pressure on all those nerves that go to his kidneys and digestive organs and all of those things. And then after care, now his spine is nice and straight, and look at what's missing. No more catheter, because his kidneys were now functioning at 80%. He went back for a checkup with his doctor, and they had no explanation for why his kidneys were functioning. They didn't understand what he had done. He actually told them that he had seen a chiropractor, and they told him that there was no way that that was what helped his kidneys. But he hadn't changed anything else, so that's just a really cool example of, you know, something that's outside of your normal muscle spasm and headaches kind of thing. And then this here is just another easy example. A younger guy that came into our office, an athlete, very, very normal presentation, just that texting neck or PC neck or anything that you see, somebody that doesn't have a curve. If we left him like that for years and years and years, he's going to start to look like that picture before with all the arthritis and the bone spurring, because that is the wheels out of alignment. And so just after a period of 3 months, we were able to put a really nice curve in his neck. Now that acts like a shock absorber again, and he's going to be fine down the road to do whatever he wants to do and not have to worry about degeneration at all. And so one more really interesting case study is somebody that's actually in the room with us today. My wife, Lauren, is here. So I met Lauren in chiropractic school, and she had just probably a year before had a massive fusion surgery. She had scoliosis growing up, and so she has rods in her back. And we'll say that the rods didn't exactly fix the problem, but she asked if she could share a little bit of her story, so I'm going to get out of the way while she just tells you a little bit of what she experienced with chiropractic.
So when I met Daniel, I was having headaches daily, like excruciating pain. I had a really bad low back problem where my rods just go from like here to here, and so my lower back doesn't have the rods in them, and I was having a lot of pain there, and then I was having headaches like daily to the point where I wasn't doing well in school. Like I was just having so many issues with staying focused and things like that because all I could focus on was my pain. I didn't want to go places, things like that. And so when I met Daniel, I started getting adjusted by him in the student clinic, and then eventually just, you know, at home. And in like, I would say like 3 or 4 months, my headaches had slowly started getting better and better to the point that now I don't have headaches anymore. And I mean, I'll have one every couple months due more to stress than anything else, but I don't have headaches anymore to the point where like I can't do things, you know. My low back pain is still there. It's still kind of like that dull pain every now and then, but it's so much better because I'm getting adjusted regularly, like 3 times a week now. So that's just like one example, to the point where like they had talked about taking my rods out because I was in so much pain. We had talked about physical therapy, all kinds of different things, and just getting adjusted have made it to where I can like live my life again, which is really nice.
I didn't pay her to say that.
Nope. He paid me in Starbucks.
And a golden retriever. But so that's just, I mean, Lauren is, it's kind of convenient that my wife is a great case, but it just shows that, you know, even people that have had all kinds of trauma and surgeries and things added in and things taken out can still respond well to it. You can see when you came in, there's a couple little flyers there for just a discounted X-ray and exam. The reason that I put those out is just, I want to make sure that everybody at least has an opportunity to see what their spine looks like. If I'm not the guy for you, then I'm not the guy for you, but I think everybody deserves to see the X-ray and see where they're at. Ultimately, being in an office, the care plan and what that looks like to correct problems is different for every person. Just like all of these case studies, they all presented a little bit differently, and so it takes a little bit of a treatment plan for each individual. That's why the X-ray is so important, because it lets us have a window into how your body's working and that kind of thing. So you're welcome to hang around and ask questions. I'll be here as long as anybody wants to talk, but you know, Facebook Live, I hope you enjoyed the talk too. But like I said, hopefully, you know, on a monthly basis, we'll be able to cover some other topics here in the office, but thanks for being here, and I hope that was educational.
Good job. Very good.